Can't access the Google Sheet.
You're not able to access it?
Yeah. Hmm. इसका बनाया.
ये सर वहां से शेयर किया लिंक, तो आपको भी ऐड
Okay.
किया होगा सर. I'll just share once again. I've shared the link again, sir, in the group. See if you
देख वही
can
देख.
access. Right, sir.
Sir, you can start the session, sir.
Okay. So, sir, permission to start, sir?
Yeah, please do.
Sir. So, good evening to everyone. I think today we have a live faculty interaction session wherein after the end of this particular course, this is the first course on Introduction to Physical Medicine and Rehabilitation that the NPTEL has launched. And after the culmination of this course, 8 weeks course, so we are entering into the examination. So the examination, I hope all the participants would have got their would have registered for their exam and got their hall ticket also. So the exam is scheduled on 2nd of November. So this particular session, we have planned basically to kind of address certain queries if you have had during the of the course, wherein you have covered about 8 weeks of the session. So we have compiled also the we have tried to address the queries and which we have raised that we tried to collect from you. And a few of you have also joined live here. So we can first kind of, I'll just give you an overview about this course. I think since most of you would have had, just to recapitulate what we tried to address in this particular course over 8 weeks. So the course is mainly towards the introduction part, basically to give you the concept of the physical medicine and rehabilitation, how it is employed in the field of sports, and also a basic idea about the strength training and the periodization, and certain aspects about the injury prevention of it. Once the individual is injured, how we kind of get him back to the sports, return to play and return to sports, and thereafter how to prevent re-injury as well. So in the week one, so the faculties for the course were Colonel Dr. Anup Krishnan, sir has also joined with us, and myself, Wing Commander Chandrasekhar Guru. So, with immense amount of experience in the field, sir has tried to kind of give you the extract in the first 4 weeks about the course, wherein sir has covered about the physical medicine and rehabilitation overview, common sports injuries in terms of the different tissues that are involved based on the onset, how you can classify acute as well as chronic and the overuse injuries that are very common in sports, and kind of how we kind of address these injuries in the broad umbrella scope of rehabilitation. That was covered in the first week. Moving on with the second week, sir has touched upon the overview of the musculoskeletal system to have an idea about the anatomy and the biomechanics, because knowing these two aspects will definitely help in kind of understanding the concept of physical medicine and rehabilitation. So we have touched upon the functional anatomy of the upper extremity and the lower extremity, and introduction to the field of biomechanics, the basically the movement science, wherein how that can lead on to injury and the mechanism that was covered during the week two second half. And we related how these mechanisms can result in occurrence of the injury, both acute as well as the chronic injuries. In the week three, sir has kind of given you an overview about how a team immediately respond to such injuries on field. What should be the immediate kind of treatment and the first aid that needs to be given at the field of play. So that was covered in the initial part of week three. Subsequently, we also gave some kind of introduction or a broad outline about imaging techniques and various clinical and the functional assessment that helps one to kind of identify what is the problem and quantify the problem, so that further we can move ahead with the proper pointed or directed diagnosis as well as the treatment aspect of it. So moving on with the week four came to the meat of the course, wherein we kind of described about the overview of the physical therapy and the various modalities. So we started with different phases of the rehabilitation, sports rehabilitation in particular. What is the specifics of each and every phase, like the acute phase, the subacute phase, and the subsequent phase three, wherein you address towards the strength, and thereafter in phase four about the long-term re-injury prevention kind of introduction of concepts. In the week four later half, we covered about various physical therapy um, methods and the modalities that are employed in the entire sports rehabilitation program. And we also touched upon the various advanced physical therapy techniques that are available with us, so that we get to know about what kind of techniques are available, and accordingly which can be chosen for a particular type of the uh, problem, or in particular phase of the sports rehabilitation. Week five, we kind of focused on foundations of strength training, how it helps in kind of the rehabilitation, as well as kind of help in return to sports, so that the individual can perform better or as equivalent to the pre-injury status. So we also introduced the concepts of periodization about strength training and how it can be fitted into different phases of training in an athlete's overall protocol or the entire macro cycle. We discussed also about the key components of conditioning, which is again is the basic foundation for any development of any kind of motor quality. So it is important to have that concept also in mind if we want to have a successful sports rehabilitation protocol. So we also introduced about touched upon briefly on the designing aspect of a sports conditioning program, or we can kind of design the program before kind of giving the athlete to the coach per se for subsequent sports specific program. In week six, we address about two important motor qualities, which again as a major focus in terms of injury prevention as well as in terms of the rehabilitation. These are flexibility and joint mobility. We discussed the differences. We also dealt in detail about the types of stretching, how their effects, they have a major role to play in terms of injury prevention. And we also address certain techniques and the assessment methods and how to monitor these two, flexibility and joint mobility. In week seven, we discussed about various modalities used in sports rehabilitation. What are the kind of contraindications and indications, where you can employ them, in which phase of the sports rehabilitation, you can use this technique. We also touched upon certain alternative or complementary therapies that are used during the course of sports injury management, including the dry needling, acupuncture. We also briefly studied how we can integrate these kind of complementary therapies into our routine rehabilitation programs. To culminate this particular course in week 8, we also discussed about the principles of injury prevention. We gave you a intro into the designing of a sport-specific injury prevention program. Also, how you kind of the concepts of basically monitoring the load, how to manage the load. So this is again important in terms of managing the overuse injuries. So these concepts were introduced in the last week, and we also touched upon a major component, or which it needs to be, which should not be forgotten. In fact, if you are involved in kind of sports rehab programs of an athlete, is the psychological support. So we also gave introduction to the psychological impact what it has on the sports injuries, how one can kind of pay attention to this to have a successful return to sports. So certain strategies for post-injury psychological rehabilitation also has been discussed in this particular week 8. So overall, this 8 weeks course would have given a broad conceptual based idea, laying a foundation for physical medicine and rehabilitation for those of you who are interested in this particular domain. And we have not kind of gone so in depth because our major goal was to kind of give a broad conceptual based overview so that you get introduced to this concepts, have some idea about the principles that these are also part of the rehabilitation program, and thereafter we can build upon this particular thing in the subsequent courses. So this was about the courses. After kind of completing this 8 weeks course, now we have come to the final period where you are probably in the preparation phase, where you are getting yourself ready for the examination, which is on 2nd November. So meanwhile, we thought we will try to address your queries. So we have compiled certain queries I have in front of me. So I'll just read out, and then we will discuss them one after the other, and then we'll also ask any queries in case if you have from any of those who have joined online today. So going on with the queries, the first query is from Mr. Tukaram Kalyanakar. So his query was about knee pre-rehabilitation plan. So knee pre-rehabilitation plan, yes, we have discussed this particular thing as physical therapy as one of the important role in terms of pre-rehab, what you called as generally the rehabilitation is about post-injury, wherein you try to have a rehabilitation program and then get the individual return to sports. But then there are certain conditions wherein the individual or the depending on the nature of the injury, the individual would need surgical intervention. So in such individuals, it may be beneficial if you start the rehabilitation before the surgery only, and then that can kind of, in fact, help for a better outcome post surgery and help in a faster kind of regain of the basic impairment post surgery, and thereafter help in gaining the strength and the other motor qualities in a prescribed period of time. So specifically about the knee pre-rehab plan, in this particular course, we have restricted ourselves, as I said before, to a broad principles or the foundation-based concepts. So we have not specifically gone into a particular specific topic. Why so? Because this in itself has, you would have gone through the lectures, this itself has multiple factors for one to decide what kind of program has to be designed. So it depends on the individual. It depends on the injury per se. What is the nature of injury? When you say knee pre-rehab, one has to look at the initial part would be to assess, to know what is the extent of the injury, what is the tissue that has been involved, and what is the surgery that is being planned. So based on that, and what is this present state of functional impairment? So if you know what is the functional impairment, accordingly you can address. Say for example, if someone has an ACL injury, say grade 3 ACL, and plan for a surgery. So in such kind of a case, a pre-rehab would mean to you need to know what is the swelling in case of this particular individual who is planned for surgery. Obviously, if the individual has been planned for surgery, initially certain period has already elapsed, and the injury, obviously the knee has to be dry. The range of motion has to be at least more than 90 degrees of flexion. So these are the prerequisites. So the pre-rehab will obviously will focus on attaining such prerequisites for the surgery per se. And as you know, whenever there is an inflammation or an injury, so that itself will cause some amount of inhibition around the injury. So that causes muscle inhibition. So that's called as arthrogenic muscle inhibition, wherein in the joint, any structure will cause increase in the inflammatory markers, increase in the swelling assay. So there's a lot of fluid collection around the joint, which itself will inhibit the muscle which is proximal and distal to the joint. So it is important to address this particular aspect. So the focus in pre-rehab in case of a knee injury would be to reduce this pain, reduce the swelling, reduce the effusion which is present in the joint. Thereby you increase the range of motion. Thereafter you also address the muscle inhibition. So muscle inhibition as such will start to reduce as you decrease the knee effusion. But also you have various modalities to kind of activate the muscle. So you can use, electro muscle stimulation, which can kind of help in activating the muscle passively as such. So these are certain things, and once the effusion and the range of motion improves, you can also work on the strength aspect of it, wherein you can improve the strength of the quadriceps and the hamstring and the calf, so that these are going to be the muscles around the knee joint. So these has to be strengthened first. But in the same time, you should also not forget that the entire body works as a kinetic chain, right? So the focus should not only limited to only the knee joint, it should also move around the joint which is proximal as well as the joint which is distal. So you will have to address both the hip joint as well as the ankle joint. So you need to address the joint mobility per se, and also the muscles around these three joints. So the entire kinetic chain, and obviously you will also, depending on the sports involved, so you need to also address the core. So the individual as such in a injury state, so the individual is not practicing, so it is a good opportunity to kind of work on the weak motor qualities the athlete has. So you can again do a overall assessment and try to address the weak qualities of the athletes when the individual is injured. So that can also be part of your rehabilitation plan. So moving ahead with the second question, Mr. Sheikh Azhar has asked, he's a assistant
Guru,
professor. Yes, sir. You want to add
I would,
something else, sir?
yeah, I
Yes.
would like to add something.
Yes, sir. Please,
So
sir.
another factor which will decide the rehabilitation plan is going to be what type of graft the surgeon is going to use. Basically, where is going to get the tendon from, or whether he's going to use a bone tendon bone graft. And I'm talking about ACL injuries per se, since we're talking about knee, and it is the commonest surgery. So that's number one. And number two, if you know what type of graft is going to be used, there are some complications which can happen post the graft. And it is better that these are targeted prior to the surgery, and that may improve the outcomes post surgery.
Right, sir.
Thank you.
Thank you, sir. Thank you for those valuable inputs. So moving on with the subsequent question, the second question was from Mr. Sheikh. So he says he is an assistant professor, Department of Physical Education. He's a football coach as well. So he has so many questions related to rehabilitation and injury related aspects. So he's saying that yes, so many players facing shin bone pain and even having heel pains. So he says that he needs to understand the issue from their nutritions, you also from the aspect of footwear, the shoes they wear, and whether they are related to their weight as well. So these are his questions with related to the aspects of heel pain and shin pain, mainly the lower limb based injuries. So to answer this, Mr. Sheikh, actually, when we see the injury model, causation model, so an injury happens not only per se because of a particular inciting event. So before the inciting event per se, we have two rather important steps: susceptible athlete and the predisposed athlete. So there are various factors that you say which can contribute to an athlete developing an injury. So they broadly are divided into intrinsic factor and extrinsic factor. Intrinsic factors are internal factors that are specific to that particular individual or the athlete. The external factors are those factors which can further kind of susceptible, make the individual susceptible to develop an injury. So if we focus on the internal factors involve the individual's anthropometry per se, the individual's intrinsic bony abnormalities. Also with respect to the soft tissues, you can have a muscle strength imbalance. You can have differences in the limb length as well. The other internal factors would mean the individual's sleep pattern, the kind of chronotropic factor, whether the individual is a morning type or an evening type. Other factor would be also nutrition and the psychological aspect. The personality of the individual per se can also be a factor, and the nutrition per se, what kind of fuel the individual takes. So these are the factors. Per se, if you see, since you have mainly asked about the lower limb based injuries, say the shin bone pain and the heel pain. If you say shin bone pain, it is more of a medial tibial stress syndrome, I would say. To be more specific, these are more common in people who are involved in excessive running and those sports which are predominantly lower limb based sports. Commonly seen in, say, military recruits and cadets, where you have excessive running based training programs. So this is more about the shin pain. Obviously, the football players as well, more so. If you see the intrinsic factor, the level of athlete also is an important aspect. So level of athlete, I would mean initial newcomer or a experienced player. So this is the two different levels you can have. So these injuries are more common in the individual who are novice are just started playing, so the body is not completely tuned up. So we discussed about the concept of conditioning. So wherein conditioning per se will help in kind of addressing these aspects in a newcomer. So that is one important factor that we have to keep in mind when we are considered concerned about the lower limb based injuries. Coming on to the extrinsic factors per se are related to the surface in which the individual plays, say, a slippery surface post rain. So that can become a susceptible, factor. The other important factor would be the footwear, what type of footwear the individual wear. So here there are two factors. One is the type of foot, the individual's type of fit. There are different type of fit which needs to be assessed. When you assess, you have a pronated fit or an supinated fit or a neutral fit. Depending on the foot size or the type, you have the footwear that needs to be chosen. So the footwear also plays an important role, and also the quality and the quality of the footwear also is important. Say, not only the right fitting and the right footwear for the type of fit, but also the almost for how much duration the individual is using the footwear, because the footwear has certain amount of biomechanical property to absorb the forces. So the more the duration of the footwear being used, it will lose its property, right? So obviously then it will not absorb most of the ground reaction forces. So that would be transmitted directly to the lower limb. So that again can become a important factor. Needs to be catered, especially in those individuals who train for longer duration of time. And the other important extrinsic factor would be the training error. The most common, I would say, is the training error, because the periodization of this training program itself is shown to kind of reduce the chances of injury and also helps in peaking at the right time. So it is not only important as a concept to kind of provide the right training for peaking the performance, but also to reduce the injury. So this is one of an important extensive factor that will address the overall injury prevention, and mainly so the overuse type of injuries. Inciting event, obviously, inciting event, one cannot have much of a role to play in an inciting event. Inciting event here would be, say, for example, individual is hit by another opponent while playing football. So that cannot be kind of really predicted. However, yes, in certain sports, you can also predict or prevent such event by choosing the right opponent, especially in terms of say combat sports like weight category sports like boxing or wrestling, where if you are doing a training session and if you don't choose the opponent of the equal capability as well as the weight category, so you may prone make that particular athlete who is low in terms of technique and also low in terms of the weight and the strength and the other important sport specific abilities, will definitely is at a higher probability to develop an injury. So again, this is also an important factor. So when we say particularly about injury prevention, sir had covered about this aspect in depth in his lectures. I would also direct you to go through another course on essentials of sports injury prevention, which again we have launched in NPTEL. So that would give an in-depth idea about the injury prevention models and how one can kind of use various strategies to prevent such injuries. So I think I've broadly addressed most of the queries that you had with respect to the lower limb based injuries, with respect to the other factors that can make that individual susceptible to such kind of injuries. So further, if you want to know further in terms of in-depth reading, I would direct you to that particular course, because that's again an 8 weeks course which has dealt only with respect to the injury prevention and the broad concepts. So that will give you a better idea about the injury prevention protocols. Sir, if you want to add anything, sir, in case.
Yes. So the question is that shin pain, heel pain. So if you say shin pain or heel pain, then all the factors which Dr. Guru has brought into play will come into play. But there is also one thing which I would like to look at. I would like to look at the training load upon the individual. And it has been shown that sudden increases in volume or sudden increases in intensity predispose a susceptible individual to these sort of repetitive stress injuries. But if you say it is heel pain and shin pain, then I would like to think of something which is systemic in nature or generalized in nature, such as, say, low vitamin D, osteopenia, osteoporosis, or one of the inflammatory disorders. Yeah. Thank you.
Thank you, sir. So moving on to the next course, next particular query is from Mr. Islam Khan. So he has asked about this course. I think to start with
Guru,
this particular,
your
sorry, sir.
video is off, Guru.
Yes, sir. Thank you, sir. So the next question is about, he has asked about this particular course. So I think in the initial introduction to this session itself, I have covered broadly the purpose and the goal of this particular course and how we have gone about over the next 8 weeks of this course. So moving on to the next question, Mr. Shashwat Pare has asked about prevention and rehabilitation practices for athletes who are susceptible to certain type of injuries. So, the previous questions we had discussed about the factors that can kind of make an individual predisposed to injury. So, how do we prevent it? Again, this is a very important aspect. If we know, first of all, we need to focus on these factors which are important and found to be scientifically have been proven that addressing these factors would kind of definitely reduce the burden of injury. So I would say one has to first, before an individual is involved in sports, it is important that a proper, um what do you say, a musculoskeletal assessment to start with is important. So that will help us to identify what is the intrinsic factors that one particular individual is possessing. So leg length discrepancy, which is come on a fairly common kind of a condition, musculoskeletal thing, probably may not be a permanent thing, maybe because of the different muscle imbalance as well. So this such kind of intrinsic bony abnormalities have to be kind of assessed and then diagnosed in the initial phase before the individual kind of involved in the sports per se. Say individual, if the individual has a increased Q angle because of genu valgum, which is intrinsic in nature by birth itself. So that is again an important factor that one has to address, whether the individual will be able to continue with the sport, or we can have any kind of additional, programs which can be instituted to kind of prevent injuries in such kind of individual. Say assessment of the muscle strength. Say we have various researchers done wherein the strength ratio between the agonist and the antagonist groups, say for example, quadriceps and a hamstring group, it should be 0.5 to 0.8 depending on the nature of these sports. So if this particular ratio is deranged, and if there is a variation between the right and the left itself, so these are certain things which one needs to kind of find out in the initial phase itself, so that we can try to address these things when we plan the program per se. So that's about the intrinsic factors. Further, moving on with the other factors, when you say the nutrition, so nutrition again, you must be aware the entire periodization of the particular sport depends on the addressing the training program as per the bioenergetics, the fuel that is required. So, say for a sprinter, the periodization is completely different, where you are focused on explosive strength and speed strength. And vis-a-vis, if you compare with a marathoner or a long distance runner, it is more of an oxidative system, where it is more into the oxygen oxidative phosphorylation. So here the periodization of the program per se is completely different depending on the basic bioenergetic fuel that is involved. So in such cases, the prevention also is targeted towards the type of nutrition that the individual is going to take. So depending on that, that also kind of help in preventing the injury. Further, when we address the extensive factors, as Colonel Hanup Krishnan brought out earlier, most important factors I would say in preventing an injury would be the training periodization. So if you're able to periodize the entire macro cycle and thereafter have multiple mesocycles based on the quality that needs to be developed, and further divide them into microcycles depending on the fitness program that you are planning, based on the volume and the intensity of the various fitness variables that you want to develop over the period of that particular mesocycle. So such kind of planning will definitely help in kind of promoting a better adaptation, as well as reduce the chances of overuse injuries per se. That is about the training. Extrinsic factors further would mean, again, preventing in terms of injury prevention would mean focusing towards proper footwear, choosing a right footwear for the right kind of event that you're planning. Say, for example, a sprinter, obviously, you need to have a better there will be more of a forefoot running. So you need to have better spikes that can give adequate grip to that particular individual, and should be well-fitting shoes. And these shoes have to be frequently supervised as well, and they should be inspected by the coach or the athlete support personnel. So most of the time, the athlete per se are aware that how much is the kind of mileage of that particular shoes that they are using. So that needs to be focused upon. And one another important aspect which I didn't touch upon in the previous thing is the equipment that is being used by the individual. So again, especially in growing athlete, when they keep training as they grow, the say for example racket sports, the grip needs to be kind of frequently checked depending on the growth and development of the athlete. As the child grows into adolescent, thereafter into adult, the grip and the size of the hand also changes. So accordingly, the equipment also needs to be addressed accordingly. And whenever there is a change in the equipment, it is important that the initially there should be some period of conditioning with the new equipment, and thereafter the once the individual is used to that particular equipment, then a regular kind of periodization of the training program has to take place. This is about broadly about the injury prevention models that we have. Per se, during the time of the training session, uh, uh, it is also seen, especially say take an example of football, wherein warming up again has a major role to play, because preparing the respective group of muscles during the activity to be um, ready for the activity. So that is important. So a proper warm-up protocol incorporating the principles of warming up, say starting from a general warm-up and moving on to a specific type of warm-up and then getting into the activity. So say I would say example of FIFA 11 plus, wherein the FIFA has introduced this FIFA 11 plus warm-up protocol, which kind of has found to reduce the injuries in football drastically. So you can also have a tailor-made injury prevention program in your periodization per se itself. So that can also kind of reduce the injuries. When I say warm up, it is also important to focus on the cooling down. So once the activity is done as per the plan, then the individual should also, as importantly, the same kind of importance should be given to the cool down time as well. So the cooling down also needs to involve more of static stretches and slowing down the heart rate as well. And more importantly, the last point which I would like to highlight is the recovery time one has to give. So when we focus, when we commonly focus mainly on the activity sessions only, but then it is important to understand scientifically that more than the activity that you give, it is the recovery period during which the actual adaptation happens, which we have also covered in our lecture about the general adaptation syndrome, where the adaptation actually happens during the recovery phase. So if we are not giving proper recovery between the activity sessions, so we are missing the bus. So that may in fact put the individual into under more stress, and that itself can predispose to individual having something called as a relative energy deficiency in sports. So and over a period of time, even that can predispose that athlete to overtraining syndromes. So these are the main aspects that I would like to incorporate in an injury prevention aspect when you're dealing with the athlete. Sir, anything from your end, sir?
No, Dr. Guru, you covered it very well. Thank you.
All right, sir. Thank you, sir. So moving on with the next question. This is from Mr. Ramesha KD. Which sports injuries may apply from ice therapy, and what are the indications and contraindications of ice treatment? So mainly the question is about the cryotherapy. So when we speak about cryotherapy, we have covered it in that acute phase of injury under the PRICE protocol or the police protocol, wherein cryotherapy is one of the important component. When do we need to apply ice? In acute uh, injury or in the first 48 hours. The time of injury till the first 48 to 72 hours is the time wherein you have increase in the pain, increase in the swelling, and there are the acute signs of inflammation. So that is the time you wanted to reduce the kind of swelling and the pain. Further, cryotherapy also is seen to reduce the secondary effect of an injury, because whenever there is an injury, obviously the immediate effect or the response is because of the injury per se, but because of the lack of blood supply to that region, it also causes secondary injury because of the hypoxia or the lack of oxygen itself. So and also because of the acute injury, there's a lot of release of chemicals in and around that particular injured area. So that also causes secondary injury. When we use ice, what it does is it reduces the blood flow to that region. So as such, it will reduce the kind of bleeding if it is there. And secondly, it will also kind of numb the area around this particular injury. So that will reduce the pain. And decreased blood supply means reducing the development of the swelling. So when the swelling is low, obviously the movement is also better. When you have more swelling, so the swelling will as such will restrict the movement around the region. So these are the benefits of ice therapy. When it has to be applied, it is to be before 72 hours. And how frequently it has to be applied? You must remember also that inflammation is also required for the body to heal. So it is like providing highs over a distributed period of time. So you apply ice for a period of 15 to 20 minutes, depending on the region. So if it is in a thick region like thigh, so you will have to apply ice for a slightly longer period of time. If it is a superficial region like say wrist or forearm, wherein there is not much of tissue surrounding the injured area, there you can apply for about 10 to 15 minutes. Depending on the region, the time varies, and it has to be repeated at least say once in 4 hours. So generally, what we prescribe is at least 3 to 4 times in a day, distributed over the entire duration of the day, and apply for 15 to 20 minutes. So that we also give that interspersed period between the application of ice to for the body to have some inflammatory response to happen as well. So that will help in healing. Indications and contraindications, yes, indications mainly in acute setting, wherein you have an acute injury, you can go for ice. Also, cryotherapy can be used in chronic injuries as well, but then not as a main kind of modality, but then basically a modality to reduce the pain after an exercise in terms of cryokinetic therapy. So wherein you can use ice to kind of promote range of movement. So that is again another use in the chronic conditions as well. Contraindications, if you ask me, contraindications, obviously, if someone has any vascular or neurovascular problem in the extremities, so there it is better, preferably to avoid. If someone has, increased anaphylactic reaction to, cold or ice, so in such people, we should avoid. And also avoid applying directly to the skin or open region, wherein it may make the kind of injured area prone to infection as well. So it is important to always cover the eyes and then apply it with some kind of padding between the eyes and the skin, so that that will also avoid the direct contact of the eyes. In case of extremities, say if there is an injury beyond the wrist or in the ankle and the foot, where you can also go for immersion type of cryotherapy, wherein in a tub of water, you can add some ice cubes and then ask the individual to dip, because these are irregular surfaces wherein applying ice bottle or an ice pack may not be able to disperse that cooling effect equally. So in that case, you can go for an immersion kind of a thing in the extremities. Sir, anything you would like to add, sir?
No, you covered it very well. Thank you.
Okay, sir. Thank you, sir. So this another question from Ms. Padma Nori. Rehab exercises are not mentioned. So again, I'll have to emphasize this fact that this particular course is mainly to address the principles or the foundational concepts of physical medicine and rehabilitation, because physical medicine rehabilitation itself is a graduate course. And thereafter, you have a specific postgraduate, focused courses for all this particular specific, like you have MPT in sports, you have MPT in neuro. So that's the kind of vastness of these fields. So it is very difficult to go for specific rehab exercises given the short duration of 8 weeks. So, however, we have tried to address most of the principles that one need to understand to have a broad idea about this. So, and we have also given certain broad ideas of the foundations basically, so that you can kind of tailor make the exercises based on your pre-existing knowledge. However, we also have other courses which are related with physical medicine and rehab and sports rehabilitation, which you can go through the NPTEL platform, and that may give you more or make you more wise on this particular aspect. Sir, anything that you would like to add on this particular question, sir?
Yes. So this is basically an introductory course, and it allows you to get an overview of what is possible in this specialty. We cannot cover exercise prescription and exercise therapy in detail in an 8 weeks course. So let's get the basic understanding clear. This is an introductory course. Now we have shown the torch. We have lit the torch and shown you the way. Now it's up to you. How do you want to take it forward? Whether you want to go for a specialized course, whether you want to go for a post graduation or a PhD program, whatever. Okay. Expecting exercise therapy to be covered in an 8 weeks course, slightly difficult and may not be very feasible also. Okay. I will cover the next question.
So,
There's a question by Durga Pada Dolai. Is there any scope of hands-on training? Again, this comes back to the same question. It's an 8 week course. It's an introductory course. Difficult to teach the nitty-gritties of uh, each slide. If you look at it, basically each slide is a topic for an hour's lecture, and we have tried to, compress and bring it down to a slide so that we are able to give you an overview. Right? Hands-on training. At the moment, no. IIT Madras and the associated centers are trying to look at identifying centers where hands-on internships can be offered, but may be possible in future. At the moment, no. Right? I hope that answers your question.
thank you, sir. Thank you for taking on this question. So, moving ahead with the next question, I think Ms. Arati Sara Sunil has asked a question for an elite racket sport athlete. What would be the rehab protocol for stress fracture in the wrist joint? What would be an ideal period to be back on court? How to go about the prognosis? Also, how to diagnose stress fractures early, since it can be misinterpreted as ligament injury. So, at the outset, thank you for this particular question. I think it's a very targeted, specific question. Probably you might have a clientele, I think. So, yeah, you are right. With wrist joint, the stress fracture of wrist joint is a difficult injury to handle. Because, as you said, it's a racket sport and an elite athlete. Obviously, it is a overuse injury, and the training, probably training error would have been a an factor that would have led to this particular stress fracture, or even a misdiagnosis also could be, I would say, because it is important as a athlete sports personnel to know what are the type of injuries that are common in particular type of sport. So if you are involved as an athlete support personnel, it is paramount that you should be aware of the type of injuries that your athlete are exposed to, and the chances of they occurring that particular injury, you must be aware. If you are aware about such things, it is easier for you to plan for those injury prevention programs. So not all injury prevention programs will kind of prevent the injuries, but at least awareness and knowledge about such kind of diagnosis or such kind of conditions can help you to think of such conditions. So early diagnosis in such kind of cases is very important. If only if you are able to diagnose early and correct, it is important to provide the focused and correct management as well. So timely management is crucial in kind of addressing these injuries. As long as if you're able to diagnose the injury correctly, the management would fall in place depending on the condition. So in this particular case, you're asking what would be the ideal period to be back on the court is a very difficult question to answer with limited knowledge about the case, because it is important to know in depth about based on the assessment and the functional assessment basically. And generally, as a if you see stress fracture, generally you need say 4 to 8 hours, 8 weeks of um, rehabilitation, mainly for the bony kind of treatment per se. But then once that has happened, it is again important to institute a proper sports rehab program and to go through all the phases that we have discussed in the lectures. And then based on the improvement shown by the individual with objective criteria that you would have to progress from one phase to the other phase, we'll be able to kind of estimate roughly the period that the individual can be back on the court. And it is very difficult to say from one point of time how much time the individual will be taking to go back to court at that elite level. And with respect to the prognosis, yes, a stress fracture, especially if there is joint or so we don't know what is the bone that is involved, maybe a scaphoid or lunate. So commonly these are the two bones that are involved in the wrist joint and more, prone for such injuries. So again, it depends what is the extent of the injury and how and the individual is responding to the particular treatment. So based on that only we can kind of uh, comment on this particular question. How to diagnose stress fracture early? Yes, as I said early, you need to have the idea that these injuries are also possible in such kind of athletes. So if you have that kind of idea, so you can go for early, imaging techniques that can help to provide certain things. And it doesn't mean that you have to go for overkill, go for kind of overdiagnosis. Not every injury would require an advanced imaging technique to diagnose. So it depends on a clinical assessment, the nature of the injury, the mechanism of the injury, and an extent of evaluation per se, and then how the treating physician has to kind of take a call on whether to go for an advanced imaging technique or not. So I that is my take on this. Sir, anything you would like to add on to this particular question, sir?
Yes. So basically, stress fracture occurs due to some imbalance between the training load generally and the body's ability to recover, right? Basically, there are some micro trauma which keeps happening and the body is not given enough time to recover, either because of inadequate recovery time or because the training load is improper. Now, if you're talking about racket sport, I would also want to know about the patient's racket, whether the racket has been changed in the preceding few weeks, whether the thickness of the grip has been changed, whether the grip has increased, grip thickness, or has it been reduced, whether the tension of the racket guts has increased or reduced, whether the coach has been making the athlete play with wet tennis balls to increase the you know uh, resistance while hitting a shot. So all these things I would like to look at when we are talking about specifically racket sports. Thank you.
Thank you, sir. These are very important clues that one needs to actually focus when we are looking at overuse injuries, especially the stress fractures. Moving on to the subsequent last question, Ms. Prachi Pal. What are the chances of question in exam to be similar to assignment questions? Okay, so I think this is a very focused question in an attempt to clear the exam. So I'm happy that you have raised this question. So yes, so we generally try to keep the questions as similar to what we have covered in the 8 weeks of course, and what you have kind of been given during the weekly assignments as well. Having said that, it doesn't mean that it will be the repetition of the same questions. We have also added a few questions to test your kind of knowledge, how much you have learned from this course and you are able to apply in your day-to-day kind of practice. So do expect certain questions of application oriented, but however, we have also kept the question paper in a more holistic way so that you will be able to kind of address most of these aspects if you have gone through the complete 8 weeks of the course and you have completed the assignments. So, is there anything from your side, sir?
No, I think you covered it very well. So yes, madam, there will be questions. We have tried to keep the uh, weekly assignments to give you an idea about the type of questions which will come. Yes, similar questions may be there, but dissimilar questions will also be there, and there will be some questions which will test your application knowledge.
Right, sir. So, thank you, sir. There is another question in the chat box. Dr. Satish Chandra Pandey had raised. May we get some written material for preparation for center-based exams? So, Doctor, we have the exam is basically MCQ based. So there's no written or more of a brief answers kind of questions that we have introduced. So since it is most of an MCQ based and we have kept it more towards the course curriculum that we have discussed over the 8 weeks period. So if you're able to go through the PowerPoint presentations as well as the videos that has been hosted in YouTube under the NPTEL channel, I think you would be able to address close to 70 to 75 percentage of the questions. So the remaining questions, obviously, as we had said earlier, they're all application based, wherein it is just basic application of the concepts. And as we have been repeatedly saying, this course is an introductory course, basically targeting the principles and the foundation layer. So it's more of a foundation based course. So we have tried to keep the questions more of application based. So it will be more or less easier for you to kind of address those questions. Yes. So anything you would like to add, sir?
No, thank you.
Right, sir. There's one more question from Ms. Padma. Can I expect AA and sports psychology programming in rehabilitation course from both of you? Sir, your take.
Yes. Thank you for giving us ideas for future courses. We will, definitely be looking into all this. Yeah.
Uh,
Thank you.
yeah, yeah. Thank you, Ms. Padma. I think that's a wonderful topic. So we will be thinking over it. Yeah, definitely we will think of such a course as well. Yeah. So if you have any other kind of questions, you can. We have 3 more minutes, so you can kind of type in the chat box. I hope that this course kind of added some value and kind of helped you in kind of your day-to-day practice. So that was the main endeavor of designing this particular course. So I think there are no more questions. Concluding remarks from you, sir, and then we can sign off.
Yes. So thank you, ladies and gentlemen. Thank you for taking the time out to go through this course and be a part of this course. Wing Commander Guru and I, we put in, including with our TAs, Rajatmani and Vedang, we put in a lot of time and effort to get this course to you in the form it has been. We are open to suggestions. If you feel that some areas of the course need to be improved, and we are also open to suggestions. If you want to suggest any follow-up courses which you would like to be seen being presented by the same team or a similar team, right? So do go through the lectures, do go through the PowerPoints, and if you need more information, a list of references has been given at the end of each PowerPoint. So we encourage you to go through them in more detail if you want to read up more about the course. As far as the exam goes, we don't want you to be stressed out too much. It will be basically a multiple choice based question and some application based questions. But if you have been regular, if you have been reading, and if you have been able to go through all the lectures and the PowerPoints, we are sure that you will be able to come through with flying colors. Yeah. Thank you, and Jai Hind.
Thank you, sir. Thank you, everyone. Thanks for joining for this live interaction session. Hope you would have learned a lot, and then all the best for your exams on 2nd November. Thank you, everyone.
All the best.
Thank
Good
you,
day.
sir.
Good day.
Thank you, sir. Good day, sir.
Thank you, sir.